Okay. Hi everyone, thank you for coming and for joining us today to honor Breast Cancer Awareness Month and Wear Pink Day. For those who don't know who I am, I'm Malika.
And I'm Yurini.
And we're here to raise awareness about breast cancer because 1 in 8 women will be diagnosed with breast cancer at some point in their lives, and it's the second leading cause of death in women in the U.S. In Massachusetts, breast cancer was the most common type of cancer diagnosed among women at 30.2% between 2015 and 2019.
It is important to mention that different types of breast cancer exist for awareness. The following information is from the American Cancer Society website. A breast cancer's type is determined by the specific cells in the breast that become cancer. Additionally, breast cancer can be categorized as ductal carcinoma in situ or invasive. Ductal carcinoma is precancer and starts in the milk duct that has not spread to the rest of the breast tissue. Invasive breast cancer has spread to the rest of the breast tissue and is present in 70 to 80% of breast cancer diagnoses. Some types of invasive breast cancer include triple negative, which is aggressive. The cancer cells lack the receptors for estrogen and progesterone and don't make the protein HER2. Triple negative accounts for about 15% of all breast cancer diagnoses. Another type of invasive breast cancer is inflammatory, which inhibits lymph vessels in the skin, resulting in the breast to look inflamed. This is rare and accounts for about 1 to 5% of all breast cancer diagnoses. Less common types include Paget disease of the breast, which starts in the ducts and moves to the skin of the nipple and the areola. It is found in 1 to 3% of all breast cancer cases. Another less common type is angiosarcoma, which begins in the cells that surround the blood vessels or lymph vessels. Some are related to radiation in that area. It is less than 1% of all breast cancer diagnoses. Furthermore, Phyllodes tumors can grow in the connective tissue or stroma of the breast. Most are benign but can be malignant. It is important to highlight advancements in breast cancer diagnosis and treatment as well. The following information is from the Susan G. Komen website. Cerianna is imaging that detects estrogen receptor positive breast cancer. Other advancements include targeting cells that hibernate after initial treatment. Furthermore, the HER2-DX test allows doctors to find out which patients can avoid chemotherapy safely. For therapies, Dato-DXd, which is currently under evaluation and specifically aims at targeting a biomarker to target specific cancer cells instead of healthy ones. In addition, lasofoxifene is a potentially new treatment to help out people that are prone to mutations in the estrogen receptor gene after initial treatment. Like last year, we want to highlight the fact that men can be diagnosed with breast cancer as well. According to the Breast Cancer Research Foundation and the American Cancer Society, in 2023, 2,800 men will be diagnosed with breast cancer and approximately 530 will die from it. About 176 men will develop breast cancer in their lifetime. Breast cancer in men is responsible for less than 1% of all breast cancer diagnoses.
So by raising awareness, we hope to empower women to take control of their health by performing self-exams, understanding the risk factors such as family history, genetics, and lifestyles, and scheduling mammograms every 2 years starting at age 40 or more frequently if you have a family history of breast cancer.
We want to thank you again for being here. Your participation means a lot. Please check out our table with resources and pins and help yourself to some refreshments. And